second is that how do we utilize the lessons learned from the road transport response to stimulate greater economic growth in the post-COVID-19 period? So these challenges require immediate attention, given that the global transport industry, which has been greatly affected by the pandemic, has witnessed huge losses in revenue due to tremendous decline in patronage. So based on this, we formulated aims and objectives towards solving the problem that we have identified. So the aim of this study was to examine how transport operators in Nigeria have coped or responded to COVID-19 challenges, as well as how lessons learned can be used for future programs. So in order to achieve this goal, we formulated 5 objectives. The first objective is to identify and categorize new technologies, processes, and procedures used by road transport operators to respond to the pandemic in Nigeria. The second objective is to evaluate what opportunities that are available in road transport sector, as well as result of national response, and how these opportunities can be well utilized. Then the objective number 3 is to collect lessons learned about infection control and public health safety measures for both formal and informal transport system. Then objective number 4, to collect perspectives of road transport operators on opportunities presented by COVID for transition to low carbon and cleaner transport system in Nigeria. And the last objective is to understand how road transport operators are grappling with the issues of inclusion, especially with regards to persons with disability, the age, women, and the children. I hope you are hearing me. Hello? I hope you are hearing me.
Yes, we're following. We're following, sir.
Yes.
Okay. So the methodology we adopted in this study, we use mixed method. That is, we use both qualitative method and the quantitative method. The qualitative method was obtained through semi-structured face-to-face oral interview, in order to identify new technologies and innovations, processes and procedures employed by the road transport in responding to COVID-19 pandemic. Then the quantitative method was to obtain an empirical data through the use of questionnaires on perceived effectiveness of road transport responses to COVID-19 pandemic from the stakeholders. Then we use multiple criteria analysis principles and principal competence analysis to analyze the data we collected from both quantitative and the qualitative methods. So the respondents we are supposed to interview 20 respondents, but due to NSAS protest that coincided with the survey, we were able to interview only 17 out of the 20 respondents. So each of those 17 respondents, we are choosing from Enugu, Lagos, and the Abuja, and they represent the 7 categories of transport of operators in transport sector: the regulators, the public operators, the quasi-public operators, organized group, organized independent private operators, organized virtual operators, and the courier operators. So based on this, we came out with the following findings. We discovered that road transport operators in Nigeria applied new technologies and processes and procedures in their response to COVID pandemic in Nigeria. For example, they use WhatsApp, they use video call, they did a quick adoption of NDCE protocols, safety protocols in terms of response to COVID-19. They also use ICT-based innovations. For example, there's a company in Lagos that specializes in repairing machines that dispenses money, ATM machines. They use WhatsApp to organize their workers so that they were able to operate very well and maintain all those empty machines so that there was no lack of money during the lockdown. So we discovered that there are so many processes and procedures that they use, and most of them are ICT based. They also use online booking. Online booking. Also, they use Zoom conferences. They work at home, so they adopted a lot of procedures in terms of responding to COVID-19. And we based on this, we recognize that it was based on these responses that Nigeria may have recorded low infection rates and deaths in terms of what COVID. Then the new technologies which we identified, which we are phase one in all, we examined them thoroughly, empirically, and we discovered that they were used effectively by road transport operators in responding to COVID-19. For example, they adopted wearing of masks, physical distances, cleaning of convenience, public enlightenment were effectively used at a very high level to respond to COVID-19 pandemic. So based on that, we did a PCA analysis. We did a PCA analysis to empirically examine the responses of road transport operators, which we obtained through the face-to-face oral interview, to know how they were effective, to empirically assign the effectiveness to each of those responses. And based on that, when we analyze them, we discovered that lockdown was the most effective method they used in responding to COVID. It was followed by NDCE safety protocols, environmental sanitation, promotion of hygiene, information technology, face masking, and physical distancing. Others are inclusion. They use inclusion with respect to the vulnerable people, and also they use mass media. They were effectively used in responding to COVID-19 pandemic. So now, in the second objective, which is the result of that, is to know opportunities that are available in the road transport sector because of national response to the pandemic. So we discovered that there are a lot of opportunities created by what? Created by pandemic. You know, in every difficulty, in every problem, in every tragedy, there's always an in Nigeria with respect to road transport sector. We discovered that number one, which is the most important of all the opportunities, is that it gives opportunity for development of a new business model. Also, just 1 minute. Just 1 minute, please. My system. Then number two is that it gives opportunity, business opportunity for modernization of road transport system in Nigeria. Then number three is application of information technology. It created room for what? For opportunities in terms of what? Application of information technology in road transportation in Nigeria. Also, it provides opportunity for revitalization of road infrastructure in Nigeria. Road infrastructure in Nigeria are in a very poor state. So it gives opportunity for the road infrastructure to be for the revitalization to meet the needs of the current needs with respect to the pandemic. Then the development of sustainable transportation models. You know, in Nigeria, we focus so much on what? On the use of a fossil fuel as a means of transportation. So it gives opportunity for the country to develop a transport model with respect to what sustainable means of transportation. So then the third objectives talk about the lessons. What are the lessons? What can we learn? How can we apply these lessons? We can apply these lessons effectively in emergency response situation. In emergency response situation in Nigeria. So we can learn from this in order to address effectively the emergency response in Nigeria. Then in terms of inclusion, we discovered that road transport operators operated effectively in terms of inclusion. They took care of of the vulnerable in the society, the less privileged people in the society. We are taking into consideration in their operation during the pandemic. So they operated effectively in terms of their responses with regards to the vulnerable people in the society. Then our findings also shows that opportunity exists in terms of energy transition to low and carbon energy in Nigeria, low carbon energy in Nigeria. All the while in Nigeria, attention has been on fossil fuel, but there are opportunities that exist. It has created opportunity for development of energy transition in Nigeria to take place. So based on these issues, we came up with the recommendations. Based on these findings, we came up with recommendations on how road transport, how the system can be improved so that the responses will be effective in terms of addressing the challenges posed by the pandemic. So based on that, we made the following recommendations. Number one, that there should be continued vigilance and application of measures that are worked well by all stakeholders in Nigeria. We discovered that the measures that are applied by road transport operators are effective. And we are now recommending that the road transport operators should not lower their guard. They should continue to do what? To apply the measure in order to avoid the second wave or the pandemic. Also, we recommended that there's need to tap into the opportunities presented by COVID. In every problem, in every tragedy, there is always an opportunity. And COVID-19 has presented wonderful opportunities for us to tap in. So we recommend that these opportunities that we have enumerated in our work, that investors should tap in on this opportunity to create a better environment. Then the third recommendation is that infection control should guide our responding. But the lessons we learn from this should guide our future response to pandemic. We should not end here. We should prepare ourselves and apply it in case of outbreak of future pandemic. Then number 4, investment opportunity presented by COVID for energy transition to low carbon and clear energy system in Nigeria are enormous. So we are recommending that these opportunities should be tapped by investors to develop a sustainable transport system that will rely so much on renewable energy than on non-renewable energy. Then the fourth recommendation we made is that there should be policies on inclusion. We discovered that although the road transport operators operated very well in terms of inclusion, but they were done on a sympathy basis, not based on policy. So we now recommend that there should be a policy there should be an effective policy that should address this aspect in road transport system in Nigeria. That it should make mandatory that road transport operators should include inclusion with respect to the vulnerables in their operations, not as a result of what? As a result of sympathy. And of course, we also recommended that lessons learned from transport systems provided for emergencies and essential services should guide our future responses to the pandemic and other future occurrences. So, based on this, in conclusion, we discovered that, based on the community, we discovered that there's been a lot of efforts in containing the pandemic, especially the recent breakthrough in science, which has given us three major vaccines for controlling the pandemic. And those vaccines have been proven to be effective. So we also now say that these vaccines should now complement the efforts of road transport operators in responding to the pandemic in Nigeria. So here, I finish the presentation. Thank you. I wait for your response. Thank you. Can you hear me? Can you hear me?
Yes, we can hear you. We can hear you, sir.
Yes, we can hear you.
Yeah, thank you very much.
So I'm through with the presentation. So
can we get the recordings?
Yes, I had a little problem. My computer went off along the line, but I brought it back. It went off along the line. My computer switched off, but I've recovered it. So yes.
All right, we're recording the presentation. It will be shared. Okay. The link to it will be shared after the program.
Okay.
Thank you, Doc. If there are persons that have some comments, questions, please bring it on now. Thank you. Please, are there questions or recommendations?
Hello.
Yes.
Hello.
Good afternoon.
Oh, good afternoon.
Okay, so I have a question. I didn't come in the beginning because of the time factor. I actually was waiting for 12 o'clock and I now saw the text, so now had to come in. So
from where are you coming from?
Okay, in the UK.
Okay.
Yeah. Okay. I want to ask. You mentioned in the last part that there are opportunities that the COVID presented for road transport, and I don't know whether it was you found those opportunities, because I would really want to know the opportunities the COVID presented.
Yes, it presented opportunities. Number one is that the opportunities are in 6 categories. For example, it gives opportunity for development of green transportation in Nigeria and other West African countries. Also, second opportunity in terms of energy swaps. What's energy swap? The shifting of fuel subsidy to what? To renewable energy subsidy. It gives opportunity for that, because once that is done, there will be a reduction in the price of renewable energy, a stimulant for energy transition. Of course, the third one is in terms of improved air quality, because notice that during the pandemic, there was lockdown, and this lockdown resulted in reduction in what? Emissions. So it gave opportunity for what? Improvement in air quality. So then the third one is what? Climate change mitigation. This is the fourth in terms of hierarchy. A lot of measures have been, one of the challenges facing the world now is climate change. So with the pandemic, it gives opportunity for what? Development of technologies that will address climate change in Nigeria and other developing countries. Then, of course, investment in green energy infrastructure. You know, in Nigeria, there's lacking in terms of what? Investment in green energy infrastructure. So this gives opportunity for investors to do what? To invest in the provision of what? Green energy infrastructure. Is vastly lacking in Nigeria. It's vastly lacking in Nigeria because you rely so much on fossil fuel. So it gives us opportunity to investors opportunity to invest in green energy infrastructure, which is vastly lacking in Nigeria. Of course, the last one is investment in sustainable energy transport system. This is what we are lacking in Nigeria and other developing countries. So these are the 6 opportunities that are presented by COVID in terms of transition to cleaner and low energy transport system in Nigeria and other countries. Hello?
Yeah, thank you very much, Doc. I wanted to understand how the COVID presented those opportunities. That's what I'm asking.
Okay, how they presented those opportunities?
Yes.
Okay. For example, during the COVID,
yes.
There was lockdown in Nigeria. All right?
Okay.
All right? So there was lockdown in Nigeria. And as a result of this lockdown, there was reduction. There was a shift. There was a shift in terms of energy use to renewable energy. Because people now began to use electricity more than fossil fuel. So based on that, it creates opportunity that this area can be developed. All right, investors can operate there. So can operate in order to provide this renewable energy that is vastly lacking in Nigeria. So in terms of transportation. So I hope he has answered your question.
Okay. Yes, to an extent. Thank you very much, sir. Thank you.
Hello, can I make a little contribution?
Okay.
Yes.
Okay.
Yeah, go ahead. Yes.
Yeah, thank you very much, participants. My name is Donald Chuba Okeke. I'm one of the 3 principal researchers that conducted this research. I thought, let me just add 1 or 2 things about regarding opportunities, which Dr. Nwachukwu is addressing. COVID-19 emphasized cyber communication. And that cyber communication is a very serious opportunity to develop cyber cities. See, the development of cyber cities in literature has been a topical issue, but then it has not received attention until now that the COVID-19 is making it a very critical issue. You see, so now that we have COVID-19 and attention is focused on cyber communication, the prospects of cyber cities is very high now. And there has been a call in literature over the years, for the last maybe 5 years, for planners to focus attention on cyber cities, even though there are some adversities of cyber cities, but that has been the vogue of moving towards cyber cities. So now that we have COVID-19 and we're compelled to use more of a cyber communication, chances are that planners will now think seriously about developing cyber cities, which has lots and lots of advantages, even though we still have some disadvantages about cyber cities. So I see COVID-19 as an opportunity for Africa to give good consideration to cyber city development. I thought I should just mention this so that it will be on record. Thank you so much.
Oh, thank you.
Yeah.
I want to make a comment. Yes.
Okay. Okay.
Yes. The last but one speaker asked a question about COVID and transportation. And Dr. Nwachukwu said that the presenter said it has helped because people now used more of electricity in the country. You know, it reduced traveling and electricity, that it has reduced the use of fossil fuel. But in Nigeria, the hydroelectricity now doesn't really give us so much, hydro does not give us so much electricity. We are using and encouraging the use of gas. And I really think that gas is still fossil fuel. So if we use more of electricity from gas, it hasn't really reduced the use of fossil fuel. Thank you.
Thank you. Well, thank you. Thank you. Thank you. Yes, what we are saying is that COVID-19 gave us opportunity to develop green transportation. What is green transportation? It means transport systems that are favorable to the environment, that has little or minimal part or minimal impact on the environment. And we discovered that during COVID-19, the experience we had was that there was a lockdown and many people stayed indoor. As a result, there was increase in use of electricity and other renewable energy. So based on that, we can continue from that momentum by developing transport systems that are favorable to the environment, like electric cars and vehicles. So this opportunity that it provides.
Hello. Yeah, I think he has a technical hitch. Internet. Okay. While before he comes back, if there are other observations, let's hear it. All right. Go ahead.
I have a comment, please.
Please go ahead.
I get what Dr. Jibram is talking about. Her comment is really, really important because, yeah, Dr. Marsha said something regarding having COVID presenting an opportunity for sustainable transportation. It only comes into play when we are employing the use of our form of energy is renewable and sustainable. That is when that can come into play. But aside from that, Nigeria has a platform. Yes, what this paper is talking about is that it will provide a platform, at least it's showing that knowledge people should, that with this COVID, Nigerian government should think about employing this other means instead of just presenting that, because of COVID, not much people are using their vehicles, not more people are outside, everybody's indoors. The electricity we're using indoors is still not sustainable. It's not renewable energy. So it still presents a problem. That is something that should be factored. That's my comment. Hello.
Okay, thank you, Fama. Yes, go ahead.
I have a comment.
Okay, please, go ahead.
Hello.
Adobe, go ahead, please.
Okay. Good day, all. I have a comment I want to make because the research topic says innovative solution to road transportation. I didn't hear anything on sensitization of the public, education, because most of the transport companies that are using e-ticketing and it is with ICT. And in Nigeria, it's mostly the elites that can use their phone to book tickets, or they can use their phone to make transactions. But you see those that there are people that cannot, that I would say that are not well versed in ICT to use all that. So I think, and most of the transport companies we have in Nigeria, they don't have easy app that customers can easily access to. You see that any services that you want from this company, you must go to their station to make that. And then the research did not go into that. Hello?
Yes, we can hear you. We can hear you. We
So
can hear
I
you.
think it should. Hello? Hello?
Go ahead. Go ahead. We can hear you.
Okay. So is the observation I made. Maybe to be. Hello?
Hello. Yes. Yes. Your network hung at a point, so we couldn't hear the last word you said. Uh, okay. Thank you, Adobe. Are there other observations? Are there other observations?
I have one.
Okay, please, please.
Can you hear me?
Yeah, we can hear you
Yes.
clearly. Yes, go ahead.
Okay. Joy Obazi.
Okay.
I'll start with a commendation for the researchers on being able to do this study during the lockdown, despite the lockdown and despite the challenges. Having said that, the relevance of this study is also commendable. I would have loved to see I scroll through the participants here. I would have loved to see one or two participants from the policy section of our society. It's true that it's a presentation of a research project, but primarily this work is targeting policy change, lessons learned during this problematic situation, and how to utilize the results in making policy change. So I would have liked to see participants from that sector and not just academic, so that this will not, I'm glad also that UK sponsored this. So it's going to be far-reaching. Now, apart from comments on the methodology and the results, trying to connect the methodology of the work with the results, that is academic. But connecting the results to policy is where the problem lies. It shows that from their findings and their recommendations, there has to be a very far-reaching policy change, because their findings are more of practical than anything else. Changing from, or rather moving towards renewable energy. I didn't see anything on solar energy, how people charged their phones, even if there are facilities, or rather there are skeletal movement at that time, and the use of app in calling up transportation operators at that time. I know that the type of electricity we use is this off and on blink method. But having said that, please, we need to go back to the work. There is a lot of reality and context specific change that we have to make. Like they said, much of our transportation is based on road. So shifting towards use of technology, use of phone, I believe most people have phones, Many things we go out to do, lockdown showed us that you can actually do them without going out. So I was trying to scan through the results of the study to see how the use of phone brought down the need for physical movement. That should have been one of the key findings, because not all trips are necessary. Lockdown showed us that not all trips are necessary. That in itself is a big lesson. So how to cut down mobility to the essentials only. I believe the result of this studies will enrich whatever the outcome, the final document. This discussion will have to be part of it. But all in all, I thank the presenters or the researchers for this good work. It shows the reality of our transport system being predominantly road-based. Thank you.
Right. Thank you very much. Thank you. That was a very good observation. We expect more inputs. Please, if you have any recommendation, or is there any way you can, is Dr. Maxwell here? Can he address any of this, please? Or should we take more before he addresses it? Prof. Donald, please, if you're here,
Yes.
can you, yes, please respond to the recommendation you made. All right.
Let me stand in for Nwachukwu to react to one or two of the comments. The participation aspect, the first comment by Ada, I think it's Ada, that's her name. It was done. The various transport providers, they relied more on it to be able to function during the COVID, when the COVID was quite tough, because we're still in COVID. So they relied so much on WhatsApp, telephone communications, digital services. In fact, at the time that the transportation was suffering a lot of damages because of lockdown and the rest of them, digital services was getting higher and higher. So that was what they relied on. They did a lot of sensitization among the service providers, unfortunately not including the users, end users of transportation. So, but amongst themselves, the drivers, the service providers within their various stations, they were doing a lot of sensitization programs, but that did not extend to the users, transport, the transport users. So that again, we have taken note of to see how people can be sensitized about handling transportation when we have in this kind of period, this pandemic period. So we have taken note of that contribution. We're going to do something about it, possibly. Then the comment from Professor Obazi, connecting results with policy. That is also taken note of, because the whole purpose of the research being sponsored by UK Aid is actually to get good theoretical frame or foundation to now impact policy. So we're at the level of developing this background, this foundation. And I'm sure that from this point, we can now begin to try to relate to policy. So that is at the back of our mind while we're doing this research, trying to find out facts, because policy change must depend on facts, not perspectives. So we're trying to get the facts down, so that when it is time for policy change, we can do something about it. Then regarding participation by policymakers, when you have webinar programs like this, you extend your invitation to all members of the society. Now turning up to attend it's not within our powers. So you find that most times the people that attend are people that are interested in research. So those are the people that attend. You know, the policymakers, you and I know that it is not very easy for them to come and waste their time on this kind of thing. You know, so you may not find them, you know, to attending this kind of program. But it is expected that they should. There's been a problem trying to link researchers and policy people. You know, it didn't start now. It has been there all along. So let's hope that the policymakers will find the need to respond to this kind of a call to participate in this kind of brainstorming exercise. Now, what Professor Bazi said about lockdown, you know, about the opportunities that lockdown brought is taken note of, and how lockdown has enhanced the use of phone to do many things that you may not necessarily have to move around, you know, to do, especially in Africa, where we move around a lot on very many unnecessary movements in Africa. So it's good to this COVID has made it necessary for us to sort out necessary movements and unnecessary movements, particularly in Africa, where our cities are the way they are. That was why I mentioned earlier about cyber cities. Cyber cities reduces movement to the barest minimum. And it's one of the major concerns of planning at the moment. And Africa should look into it. However, we are taking note again that there is no way that when you're considering urban economics, space cannot be ruled out. Face-to-face contact cannot be ruled out, because economic activities are location bound. So these things, they have to be there is a guy, he's called Lozano Eduardo, 1990. He did a lot of work on this space movement thing, economic activities and space movement and stuff like that. And he says that the movement of people, face-to-face contact and physical proximity are still very critical characteristics of urban economic activities. Cannot be ruled out. No matter how much that we can rule out. Because it is that pandemic, goods moved, goods, services moved. The thing that was locked down was people, and it hit the economy seriously. You know, because first it hits the transportation sector. Likely, people must move. So when we are considering, cyber cities, for instance, where movement is limited, when we're considering the use of cyber communication, then we cannot sideline the need for face-to-face contact, the need for physical proximity, you know, in conducting economic activities to the full. See, so it's a matter of synthesis. It's a matter of a balance. Why not? Neither we throw each other away. The cyber communication should not throw away physical proximity, physical movement, and face-to-face contact, because you cannot throw them away. So this Lazaro also says something like, in regional economics, not even enhanced communication can fully substitute for physical propinquity in space. I'm quoting Lozano, you know, Eduardo, 1990. He said, in regional economics, not even enhanced communication can fully substitute for physical propinquity in space. So space is still there for us to consider, but again, we have to take full advantage of cyber communication. So these are some of the reactions that I have for the comments, and though we have taken note of these comments, so we have to work on them. Thank you so much.
Thank you, Prof. Thank you very much. Okay, are there? I hope he addressed the recommendation and the issue raised. Are there other recommendations from anyone? I can see that Dr. Maxwell is back. Okay.
Yes.
Yes. Please proceed.
Please ask whether there's anybody from because we invited people from the policy, whether any of them is present so that they can ask questions. We invited people from the police aspect of it. Let them ask questions.
Okay, what he's saying is that if you are in the policy area of this research, it doesn't matter if you're part of the research team. If you're from the policy area of this sort of research, you could raise some question or recommendation, please.
People from the Ministry of Transportation.
Yes.
People from the NIPOST, Nigerian Postal Services, then and road safety, the regulators. We invited them. Is there anybody from them so they can ask questions?
Okay, I see Dr. Francis Dangare. Yes. Okay. We look forward to some recommendations from you, or chipping in some things, to the discussion. Yes, sir.
Oh, hello, Boldscholar.
Okay. All right. Okay, Mr. Obiora, you're back. All right.
I'm not back. I allow Francis to continue because I've lost how to do. I've followed you guys, but my inability to contribute. I have heard all doctor presented and responses from Prof. Donald. I think they are all quite in order, and maybe Francis will just the impression he has had about our interaction, and then we'll move on. Francis.
Thank you, Oga Obiora and your team for the work that you did and the presentation.
Okay.
My name is Francis Dangare, and I work for IMC Worldwide, who are managing this the HVT program on behalf of the FCDO. I don't have much to add apart from just complimenting you for the work that you have done. The presentation was quite clear, and a lot of contributions from the participants was quite important. And I just wanted to know how you are going to take this forward. For instance, there was the issue of the sensitization and education that was mentioned in terms of reaching out to the downstream users of transport. Another participant also mentioned a very important observation that the connection of the methodology and the results is quite clear, but then the connection of the results and the policy was not that clear. And there's also no mention of solar energy and others. What I may also want to add onto the list is you mentioned something to do with gender and disability. Could you please add more detail in terms of what your lessons learned were in terms of the gender and inclusive nature of the transport system in Nigeria, and also what opportunities that the project presents in terms of how this can be addressed going forward. Also, we are talking about COVID, and that is a pandemic, right? But going forward, we may be dealing with other pandemics that are not COVID. For instance, we have had Ebola in West Africa, in Liberia and Sierra Leone. Can we actually use all those lessons to inform us in terms of as far as this project is concerned? Because what we also need to understand and focus on is how these findings are going to be applied going forward. I think that summarizes my comments, really. I don't think I've got anything else to add. Thank you.
Okay. Thank you very much. That was very
wow,
wonderful.
great, Francis. Yeah. Dr. Maxwell, can you respond to some of the things he said?
While we wait for Dr. Maxwell, can I say something?
Go ahead, Prof.
Yes, as regards the application of findings, it depends on how we want to apply our findings. If we want to apply it ad hoc, then we'll pick them one by one differently and begin to talk about them, as isolated units. If we want a comprehensive, integrated application of the findings, then we have to fall back on planning. We just have to fall back on planning, make the findings the cardinal, the focal point of planning, then have an integrated approach to apply these findings. And that is the way I would recommend that we go. Thank you so much.
Hello? In terms of issue of inclusion, or separators, they considered so much the safety of the vulnerable during the COVID-19. They consider that safety very, very well by providing by making special provision for them during the when they want to board their transport systems. And okay, we discovered that some of these efforts they made in addressing the issue of inclusion was based on sympathy basis, not on policy basis. There's no policy in Nigeria that addresses the issue of inclusion in Nigerian road transport sector. So all the efforts they made was based on sympathy to help the vulnerable, to help the women, to help the sick, to help the aged, to help the children. So we are now advocating that there should be a policy, there should be a policy guideline that will address this issue in Nigeria's road transport sector. That's what we recommended. There should be a policy. Government should formulate a policy that will address issue of inclusion. That road transport operators should not only operate by sympathy, but they should be mandated by policy to take social action with regards to what the vulnerable in the provision of transport services.
Thank you.
Okay, thank you, Dr. Machuku. I don't know because yes, I was following, and the issue of inclusion.
Hello? Hey.
The issue of inclusion. Hello,
Okay.
Can you hear me?
Yes.
Can you hear me?
I can hear you.
Yes, I said the issue of inclusion does not stop at persons living with disabilities or just vulnerable persons alone. We also discovered a very huge underrepresentation of women in the transport sector. We noted this in our report and felt that it would be good, like Dr. Machuku said, for there to be a policy response to the issue of inclusion of women in the transportation sector. During the series of workshops we had, some of our participants noted that women seem to be underrepresented in the transport sector because there is a whole lot of touting and other dangerous activities that go on with road transportation in Nigeria. And we are of the opinion that there should be a kind of policy response that can open up the space for more women to be part of the transport business in Nigeria. Thank you. Okay, and so Engineer Francis too, the lessons learned from what we have done, we found a whole lot of cooperation amongst what we call interagency cooperation amongst government agencies that helped in early responses to the pandemic. And we saw that Nigeria's emergency preparedness towards COVID-19 was as a result of the initial experiences the country has had handling Ebola crisis. And so the experiences the country had handling Ebola crisis helped the early responses, the quick and early responses that Nigeria brought over the pandemic. So we think it's a good one that going forward, some of the lessons we have learned over the pandemic could also be used in responding to similar challenges in the future. Thank you.
All right, thank you. It seems Dr. Maxwell wanted to say something earlier.
No. He has said my mind. He has said what I want to contribute.
All right. Are there other recommendations? Hello. Okay. Are there other recommendations, please?
Yeah. Go ahead. Yeah, someone wants to speak. Let him allow him. We have a few more minutes to go.
Hello.
And let all the contributions come in now.
Speak.
Okay.
Mark, speak.
Hello. Okay.
Hello. Yeah, speak.
Hello. Are you hearing me? Are you hearing me?
Yes.
Go ahead.
Loud and clear.
Okay. What I want to bring up is this issue of compliance. I listened all through your presentation, and part of the challenges is the issue of balancing safety and maintenance of business. And like you pointed out that the transporters during the COVID period try to maintain a balance between safety and their business. But I observe that since the lifting of the lockdown and the movement of goods and humans, that the transporters look like they have now relapsed again to thinking more of their businesses. You said that they came up with 51 new technologies. Are you hearing me?
Go ahead.
Yes, loud and clear.
Okay. They came up, you discovered that from your studies, you discovered that you have about 51 new technologies. Which of these technologies did you recommend the one that we assist in enforcing compliance? It's important. Enforcing compliance, the president has signed a law on this but you go around and see that nobody is complying. Nobody is complying, and nothing is being done. So in your recommendation, what are you trying to bring up that will help? Because this COVID does not move, it's human beings that move. And it is transporters that move human beings. And now we are having a new wave of the pandemic. And the transporters are all over the place. So I don't know whether it's part of your recommendation, how all these policies that have already been made can be enforced. That's just what I want to raise at this point. Thank you.
Thank you. The enforcement of enforcement in terms of containment measures with regards to pandemic is basically on government. It's government that should enforce. It's government that has the right to do what? To enforce, to bring out the rules and do what? And enforce it. So basically, it lies on the government. That's why we are proposing that government should what? Government should ensure that what? That our first recommendation that the road transport operators do not lower their guards. That's what first should not lower their guards in terms of what? Of their response to COVID-19. So it lies on the government. So we did a recommendation in the first one that government should ensure that what road transport operators do not lower their guard by bringing so many policies. Like recently, the president of Nigeria issued an executive order that made it mandatory for everyone to wear masks. This is a typical example. So that's what we recommend that policy should be taken into consideration in order to do what? To enforce these responses. Thank you. Hello?
Can I say something?
Yeah.
That is, that is why I said earlier that the application of our findings, there are two approaches. Either it is ad hoc or it is integrated. You'll find that not only in Nigeria, but mostly African countries, the application of controls, it's almost always ad hoc. You get it done, okay, fine. When the ovation is high, you do it. When the ovation is low, it is dead. So we cannot expect anything different from this the enforcement of pandemic regulations. As to the application, or as to the enforcement of all other regulations in different departments of the society of governance. So if we're concerned with ensuring that provisions or regulations are enforced and they are sustainable, then we have to look at the way we apply these regulations. I keep advocating that we have to replan to plan. We have to plan to replan. It goes into serious integrated planning so that we can institutionalize what we're saying. If we don't institutionalize the application of these regulations to contain COVID-19, it will of course fizzle away, just like that of Ebola fizzled away. And when COVID came, we tried to remember where we left off. Then now we continue with the pandemic, assuming that the COVID-19 pandemic goes off, then we fizzles out again. If another pandemic comes, we begin to remember where we left off. So that is what ad hoc application of solutions. That is what you get. You don't get anything different. So now that the pandemic is beginning it appears that the tension is coming down. Everybody is back to square one. That was what the drivers told us. That when it was high, they all comply, but now it is low. Nobody bothers. If the moment they have to they begin to have issues from from government officials. Oh well, they go up again and do it again. If they don't, they don't. You and I know that we can walk into shopping malls now without wearing our face masks. Before it was not like that. Because it is ad hoc. If we want to get it really down and institutionalize it, we have to fall back on planning, good planning. Thank you very much.
Okay, thank you, Prof. And I think we really need to bring the meeting to an end. We have overshot our lane by almost 10 minutes. But I think because the discussions have been very engaging, we have kept on and on. Let's end at 1:50. That's in 2 minutes time. So if anybody has any further contribution that will summarize what we have done today, that would be very wonderful. Can somebody summarize what we have done today? It will be very wonderful to hear. Dr. Wachuku, can you do that for us?
Okay.
As quickly as you can, so that we end.
Okay. So we have examined the road transport operators' innovative responses with regards to the COVID-19 pandemic. And we discovered that they responded effectively based on what innovations and what innovative procedures and processes. And this innovative process and procedure may have been the reason why we witnessed low rate of pandemic in Nigeria, as well as low death rate. So we discovered that there are opportunities exist in terms of what, as a result of what as a result of the pandemic, in every difficult situation, in every problem, this COVID has shown us that there's an opportunity. And also, in terms of energy transition, opportunity exists in Nigeria and the other African countries for transition from fossil fuel to clean energy. And this will bring a lot of jobs in Nigeria. And these lessons can be used in terms of what addressing future pandemic. Just like what happened during the Ebola pandemic. It was the lessons that we learned that we used to do what? To prepare ourselves for this pandemic. So these lessons learned from this can be used to prepare for future pandemic. And of course, the game changer in terms of fighting this pandemic was the discovery of vaccine by scientists. And we are saying that these vaccines should complement the responses by road transport operators with regard to what? COVID-19 pandemic. Thank you.
Thank you, thank you, Dr. Wachuku. I want to, at this moment, we have to call it a day. I want to thank all of you that have found time to be here. I want to thank Professor Donald, Dr. Wachuku, my senior colleagues, and Francis, who has been with us all the way. A special thanks to you and all of us that have participated. We want to thank you in a special way for being part of this. It will be another time, maybe another topic, and we wish to say bye-bye at this moment. Bye-bye.
Thank you.
Thank you very much.
Thank you very much. Thank you.
Thank you.
Bye.
Bye-bye. Bye-bye.